I am Heather Kuklinski, and I am the director of the Osteoporosis Clinic or Bone Health Clinic. So as a physician assistant, I work for all of the physicians and see patients for them and from physicians outside of our practice for patients who may have bone loss, osteoporosis, known osteoporosis, questionable osteoporosis, patients who may have fractured, who maybe aren't healing from a fracture, or maybe they're having implant issues, their hardware is loose or coming out. Anything that may have some type of metabolic bone disease or question, we work that up in the Bone Health Clinic. About 4.5 years ago, the surgeons came to me, I was in primary care, which is my heart and soul, I love primary care, to ask me to start a bone health clinic for them. So they saw the need for osteoporosis care within the practice, somebody they could refer to internally to help them treat patients with bone loss. They felt an ethical, really pull to be the ones to own that problem. It's a silent disease. Nobody knows they have it. It doesn't bother you day to day. And so very, very often it's left untreated. And so then they see the patient 6 months later with another fracture and nobody treated them. And then another fracture, or then their hardware fell out or their screws became loose. And so they needed and wanted ethically, they felt like they needed to really own this problem. Well, anytime you can prevent somebody from fracturing, fracture changes your life. Fracture is common, osteoporotic fracture is common. 1 in 2 women will break in their lifetime from an osteoporotic fracture. Osteoporosis is never the cause of death on anybody's death certificate. It does have a death statistic, and we all know people who have had a hip fracture and died 6 months later. We've had a grandma that did that. But it's not the cause of death, but it changes your life. And so if you can prevent somebody from having one of those fractures, a hip fracture, a pelvis fracture that might put them in a nursing home or make them have to go live with a loved one or lose their independence, that one thing we are fighting to not lose, it changes their life for the better. You may not extend their life, but you've changed their quality of life, and that's what matters.